Hello and welcome to another episode of Health Matters. I am your coach, Dr. Michael Chillemi, and on this episode, what we're going to talk about is neuropathy. We're going to get into the causes, the anatomy, the diagnosis, and the treatment. As you're noticing, I am on location at the office. We are at the Health and Spine Wellness Center, and we are in front of our wellness wall. Okay, so let's get into it. Neuropathy is a medical condition affecting millions of people worldwide. So whether you're dealing with the unexplained tingling, or burning, or numbness, or simply looking to learn more about neuropathy, we got you covered. We're going to be exploring the top 7 causes of neuropathy with explanations of anatomy, how it impacts your life, and discussing the comprehensive treatment protocols that are out there for today, from medical interventions to physical therapy to chiropractic. So with that said, let's dive right on in. So what is neuropathy? So neuropathy is referring to a dysfunction or damage to the peripheral nervous system. So the peripheral nervous system is a vast network of nerves outside of the brain and spinal cord. These nerves communicate with channels with relay sensors, motor and autonomic signals between the body and the brain. When neuropathy occurs, the communication between these systems are disrupted, leading to various symptoms based on the affected nerves. Quick stat. Who is affected? Globally, 20 to 25 million people suffer from neuropathy. Over 50% of the people with neuropathy are from diabetics. Neuropathy affects people of all ages, but is mostly common in older adults due to age-related conditions and cumulative nerve damage over time. So let's explain a little bit of the anatomy of neuropathy. So to fully understand what neuropathy is, it really is essential to understand the basic layout of the peripheral nervous system. So when we're talking about the peripheral nervous system, we're talking about motor neurons. So motor neurons control your muscle movements. Then you have sensory nerves. Sensory nerves transmit sensations such as pain, temperature, and touch. Then you have autonomic nerves, which manage involuntary processes like digestion, heartbeat, and breathing. So you have 3 different types of nerves, and they all can be affected. So let's get into it. When these nerves become damaged, the disruption can lead to symptoms ranging from mild discomfort to life-threatening complications. Damage to motor neurons often lead to weakness, difficulty moving, or muscle atrophy. Damage to sensory nerves is commonly associated with tingling, numbness, pain, often in the hands or feet. Damage to the autonomic nerves can result in sweating irregularly, blood pressure dropping, GI issues, and bladder dysfunction. So you can see there's a variety of ranges of neuropathy. It's not just one type. There's a few different types. So how can neuropathy influence your life? Living with neuropathy can drastically affect the quality of your life. Symptoms like burning pain, numbness, or impairment of motor function makes everyday tasks very difficult, such as walking, driving, typing. Very difficult. Advanced neuropathy can lead to reduced independence, right? You can't drive, you can't walk. Increased risks of falls due to weakness or imbalance, right? So if you have a diabetic, if you have a neuropathy throughout your leg and you can't feel your leg, you can fall, and that can lead to fractures and other problems. Chronic pain and lack of sleep, all can be affected. Social interactions and emotional well-being can also suffer. Many people report feeling isolation, depression, and heightened anxiety due to their situations and struggles. Okay, so let's get into the top 7 causes of neuropathy. So number one on the list is going to be diabetes, right? Diabetic neuropathy. It is the number one cause of peripheral neuropathy and is associated with prolonged damage to nerve fibers consistently with high blood pressure, with high blood sugar levels. Over time, uncontrolled diabetes can affect blood vessels that supply the nerves with oxygen and nutrients, resulting in nerve dysfunction and eventually nerve death. Typically, diabetic peripheral neuropathy impacts extremities like hands and feet. It is characterized by burning, tingling, numbing pain. If left untreated, it could progress into serious complications such as ulcers, infections, and really affect the areas. So what typically happens? So typically high levels of blood sugar damaging the nerves over time affects those extremities. And typically in diabetes, over 50% of the people who have diabetes will have diabetic neuropathy, right? So we need to fix that. Okay, number two on the list that we're gonna talk about, and it's kind of a subcategory of diabetes, alcohol use. So I'm going to say this is kind of 1A, okay, because alcohol use usually raises your sugar level, which affects your diabetes, right? So excessive alcohol consumption can lead to nutritional deficiencies, especially with vitamin B1, critically for nerve function. You're going to have these same type of effects with muscle weakness, nerve pains, and painful extremities. So as you're drinking excessively, you're affecting your whole body. Okay, so let's go to number two on the list. Number two on the list is going to be infections. Infections could include Lyme's disease, shingles, HIV. These type of conditions can aggressively target peripheral nerve, resulting in localized pain and hypersensitivity. For instance, shingles often triggers burning or stabbing along the affected nerve pathway. So you could have it in, I've had patients that had it in the middle of their back and went all the way around to the front because it was one in your thoracic spine, and one of those nerves affects the middle of your back, coming right around into the front of your chest. Other pain that you can have, like with Lyme's disease, may cause long-term inflammation that disrupts the nerve signal. And when it affects the nerve signal, it's gonna basically disrupt that signaling process. And the treatment usually involves trying to resolve the underlying infection and utilizing like antivirals and other medications to effect that condition. And you know, the antivirals are all looking to address the issue of the infection, is what they're basically trying to do. So for nerve damage lingering post-infection, physical therapy can restore function for the muscles and alleviate some residual pain through targeted activities. Okay. So number three on our list is going to be autoimmune diseases. Autoimmune diseases could be conditions such as lupus, Guillain-Barré syndrome. When the immune system mistakenly attacks healthy nerve tissue, causing inflammation and progressive nerve deteriorations, it affects patients by making them suffer. And they suffer with symptoms like muscle weakness, loss of movement, intense nerve pain. All are too common. But effective management can definitely slow down the nerve damage and restore partial function. Let's talk about number four on our list, vitamin deficiency. So a lack of essential vitamins such as B12 and B6 can wreak havoc on the nervous system, impairing nerve function and slowing down regeneration process. Vitamin B12 deficiency in particular is notable for causing fatigue, tingling sensations, and painful nerve cramps. Fortunately, correcting these deficiencies through high-dose vitamin supplementation, either orally or injections, can slow down the nerve degradation and promote repair. Okay, next thing that we're going to talk about is trauma or compression. So trauma or compression means such as fractures, nerve compression, or crush injuries. Typically something like a carpal tunnel syndrome or a car accident or a fall. Depending on the severity, symptoms may range from localized numbness to extreme pain or weakness in the affected limb. To promote healing and treatment, we want to focus on repairing the injured tissue itself by reducing the inflammation. Number 6 on our list is going to be chemotherapy-induced neuropathy. So chemotherapy drugs designed to combat cancer can inadvertently impair your peripheral nerves, leading to debilitating symptoms such as pins and needles, muscle weakness, or sharp pain. So when we're talking about platinum-based chemo agents and taxanes are notorious for causing this type of neuropathy, often leading to patients struggling with long-term nerve damage. Treatments aim to address both the pain and potential nerve recovery. So, you're trying to cure your cancer, but unfortunately, they're giving you this no other way to say it, toxic medication, and that toxic medication is, while it's trying to kill the cancer, it's affecting your body in many other ways. So, it's like, what do you do, right? So, cancer will kill you, and you have to weigh out the benefits of what you're going to get with that. But at the end of the day, you want to cure the cancer. But that's up to each and every one of you. Number 7 on our list is genetic disorders. So genetic disorders could be like sharp tooth, Marie tooth disease, CMT, or hereditary sensory neuropathies causing progressive degeneration of nerve fibers, leading to symptoms such as muscle weakness, deformities, and loss of sensation. Since genetic neuropathies often lack curative treatments, management revolves around addressing complications and maintaining mobility for as long as possible. Typically, you're going to manage these patients with pain management and other medications, physical therapy, and other modalities to help heal tissues. Okay, so how does somebody get diagnosed with diabetic neuropathy? So typically, a doctor will use a combination of a great medical history, a great physical exam, nerve test. Nerve test could be something like an EMG. Basically, it's going to help diagnose that neuropathy. So the key diagnosis methods to diagnose neuropathy are going to be blood test. So to detect vitamin deficiencies such as diabetes or autoimmune markers, EMG, which measures the electrical activity in muscles, nerve conduction study. Typically, you do an EMG with an NCV or a nerve conduction study, and the NCV is going to assess the speed and strength of the nerve signal. So with the EMG and NCV, you're going to measure the amount of electric that's going through your muscles, and then you're going to also assess how fast they're going through. The other thing that we're going to utilize is imaging. So whether it's an MRI or ultrasound, visualizing nerve compression or damage. What are some treatment protocols for neuropathy? So conservative care, lifestyle management, right? First thing we're going to do, especially for diabetes, manage your blood sugar levels. Avoid alcohol intake and optimize nutritional intake. Medications, they're going to have some pain relievers, and we're going to get into the pain relievers in a few minutes. Let's get into the holistic and regenerative treatments. Typically, we're going to talk about chiropractic first. So chiropractic, we're going to talk about two, mainly chiropractic and physical therapy. Both are non-invasive approaches that may alleviate symptoms and improve function for individuals with neuropathy. While we're a little bit different on both of them, they both try to contribute to the overall quality of life. So chiropractic primarily focuses on alignment of the spine and overall nervous system health. The logic behind chiropractic for neuropathy is that improving signal alignment reduces pressure on nerves and it can enhance their function and alleviate neuropathy symptoms. So we're going to help with the symptoms, right? That's how it's going to be affected. And how we're going to do that is we're going to do that through a spinal adjustment. So you have misalignments in your spine, known as subluxation. Subluxations, they can contribute to nerve compressions or irritations. What chiropractors do, they adjust the spine to restore proper spinal alignment to reduce pressure on the nerves, which is also going to be a side effect of that. It's going to improve your blood flow. Adjustments improve blood flow by affecting the areas and reducing inflammation. And we're going to targeting nerve function. So we're going to use techniques or tools such as electrotherapy, different type of tractions, and a whole bunch of different other therapies to stimulate nerve repair and encourage better nerve function. So the benefits for chiropractic are going to reduce pain and discomfort associated with neuropathy, improve range of motion and mobility, enhance nerve communication, and reduce inflammation. Better overall spinal and postural health, which may indirectly address some neuropathy symptoms. So some of the limitations: chiropractic care does not address the underlying systematic cause of neuropathy, such as diabetes or autoimmune disease. And while it's not a cure, it may provide symptomatic relief, right? So sometimes that's what you need to have is symptomatic relief, and that's what we do. Physical therapy. So physical therapy is a little bit different. Physical therapy is going to focus on strengthening the muscles and improving mobility and addressing the nerve-related dysfunction caused by neuropathy. It is often considered a central component of neuropathy management because it targets the physical challenges associated with nerve damage. How does physical therapy address neuropathy? The ways that they're going to address it is, one, by strength training. Neuropathy can lead to weakness, especially in the hands and feet. Physical therapy incorporates exercises designed to strengthen affected muscle groups. Stretching and mobility. Physical therapists work to improve flexibility and mobility by reducing stiffness and compensatory movement patterns. Balance training. Neuropathy often affects coordination and balance. Therapists teach patients how to exercise properly and enhance this ability and prevent falling. Different than exercising at the gym. It is patient specific and body specific and condition specific training. Physical therapy is going to improve circulation. Certain techniques like massage, light exercise, or hydrotherapy can improve blood flow to the impacted nerve areas. So the benefits of physical therapy: restore strength and muscle function, increase mobility and ranges of motion, reducing the nerve pain and discomfort, lower the risk of complications due to muscle atrophy or falls. Typically, what works really, really well is the combination of physical therapy and chiropractic together, right? So if you're combining those therapies, then chiropractic can alleviate the nerve pressure and pain through the spinal adjustments, and physical therapy can target the deficient muscles and area caused by the neuropathy and strengthen the associated area. So utilizing both can manage neuropathy in ways of managing the symptoms. Another conservative method of treatment is PRP, platelet-rich plasma. So platelet-rich plasma is a medical procedure that involves a concentration of a patient's own platelets to accelerate healing of injured tendons, ligaments, muscles, and joints. It's a form of regenerative medicine that harnesses the body's innate ability to heal itself. In recent years, PRP therapy has been explored as a potential treatment for neuropathy. And let's go over a quick overview of how that happens. So typically, how is PRP prepared? So typically, you draw a tube of your blood, and the blood is put into a centrifuge, and that is spun. When it spins down, the red blood cells drop to the bottom, your platelets are on top. Your platelets, which we call liquid gold, are utilized for the treatment of the modality. So the mechanism of PRP in neuropathy. The premise of using PRP for neuropathy is based on the ability to promote tissue repair and regeneration by delivering higher concentration of growth factors to the affected area of nerve damage. These growth factors can potentially enhance blood vessel formations, improving blood supply to nerves, stimulate nerve cell regeneration and repair, reduce inflammation, which can be a significant factor in neuropathy-related pain. How do you get it? How do you do it? What happens? So typically injections of the PRP is injected directly into the affected area. For neuropathy, this may involve injections near the nerves in the affected areas. Research and evidence has shown that there is promising amounts of benefits of PRP for muscle conditions. The utility of PRP for treating neuropathy, especially peripheral neuropathy, is always under investigation. And some reports, some studies show improvements in symptoms. Research is continuing. I can tell you from a personal standpoint, for patients that we have treated, we have definitely shown patients to have improvement and had more function and able to actually walk without feeling the fearness of falling, right? When you can't feel your foot and you're stomping down because you can't feel that foot, it is critical to really, really have that comfort to know that you're getting it back. Safety considerations for PRP. PRP is generally safe because it uses your own blood and the risk of any allergic reaction is very minimal. Limitations. Not all patients may respond to PRP, as the severity of neuropathy as well as the patient's own condition, right? So depending on your health and other conditions and other factors, everybody's a little bit different. But it is definitely promising an area for research. Okay, let's get into the medical treatments for neuropathy. So medical treatments aim to alleviate the symptoms and improve patients' quality of life. Let's go over some of the medical treatments. So typically, the first thing they're going to want to put you on is painkillers. Over-the-counter painkillers could be acetaminophen, NSAIDs, like ibuprofen, can help relieve mild symptoms. Prescription medications for severe pain can be prescribed, such as antidepressants or anticonvulsants, such as gabapentin or pregabalin. And topical treatments can be used, like capsaicin creams and lidocaine patches can be applied to the affected area for localized relief. So gabapentin is one of the big treatments that they're utilizing for basically reducing the nerve irritation. Some of the other potential treatments can include electrical nerve stimulations. Transcutaneous electrical nerve stimulations may provide relief by interfering with nerve signaling. IV therapy, administering antioxidants and anti-inflammatory directly into the bloodstream, can affect immediate effects. Plasma exchange and intravenous immunoglobulin. These treatments can be effective for neuropathies because it's caused by inflammatory autoimmune conditions. So what should your action treatment plan be? Your typical treatment plan should integrate root cause identification, targeting the primary cause, whether it's optimizing your blood sugar if you're diabetic, or trying to find that not drinking or addressing your vitamin deficiency, whatever the root cause is, identifying it. Symptom management, right? Combine medications with physical therapy and chiropractic for long-term solutions and care. Long-term repair, explore regenerative options like PRP and advanced neuromodulation. Let me give you the final thoughts on neuropathy. Neuropathy is a complex condition requiring personalized and comprehensive approach to treatments. The journey begins with identifying and addressing the root cause, whether it's diabetes, vitamin deficiency, autoimmune disorders. From symptom management through medication and physical therapy and chiropractic to cutting-edge technologies like PRP therapy, modern healthcare offers a wealth of solutions for patients to help reclaim a pain-free and functional life. Recovery is possible with collaborations, dedications, and integrations of multiple disciplinaries. Remember, healing is a process. Stay proactive, explore advanced therapies, and commit to improving your health and quality of life. So we're basically coming to the end of this, and I do want to share one of these stories that I have. I had a patient here last year that we did some physical therapy, chiropractic, and PRP with. The patient could not feel their foot. They would slap their foot every time they walked, and they were actually using a cane. And this patient was in their early 60s, and they just got their diabetes under control, and they've had this diabetic neuropathy for years. And all the patient wanted to do was just to walk, right? He wasn't looking to run marathons. He just wanted to have a normal functioning life. And what we were able to do for him is I would say within 10 to 12 weeks, it does take some time. The patient did recover to the extent that they can walk. They started to get feeling back in their foot. Now, is it perfect? No. I'm not going to sit here and tell you that it's perfect. No. They definitely had changes, and changes enough to feel their feet again and start to walk the way they did a few years ago. And for that patient, that meant the world, because that changed their life, right? They're still obviously afraid, but their level of fear has gone down significantly. And the ability to feel like they did when they were a little bit younger and not have to be so dependent was so important to that patient, that they would, as they were finishing their recovery and as they were graduating, they ring the bell and they graduate, they were very teary-eyed and very thankful that we were able to give them a piece of their life back that they thought they lost forever. And what I will say to you is there is hope, there is treatment. Every condition's a little bit different. Every patient's a little bit different. But be your own proactive person. Do your own research. Don't sit on the sidelines. Be proactive. If you don't put any effort out there, you won't get it back, right? Everything in life is effort. You got to put it out to get it. That's what's important. With that said, if this has helped you in any way, the way we grow as a channel is tell your friends, tell your family. If you know a friend or a family member that could benefit from any of this information, if they take one piece of anything I said and it benefits them, then it's worth a few minutes that it's taking them to listen to this. Share it with them. Share it with your friends. If you care about them at all and they have this condition, can't hurt them to listen, right? Maybe it'll help them. Maybe it'll wake them up to actually go and do something. Last piece of thought is the information I've given you today is my opinion alone. This is not a substitute for a medical advice. If you have this condition, please go see a medical professional or a healthcare professional for proper diagnosis and treatment. This is just my opinion. It's my opinions alone. So with that said, it's your life. It's your journey. You only get one of them. So as I always say, it's one shot. It's your health. And guess what? Your health matters. Till next time, Dr. Chillemi, be well, be safe, be healthy.